So good afternoon, everybody. The Secretary to the Government of Federation, Honorable Ministers, Director General, ladies and gentlemen. I shall be dwelling on one topic after I gave the usual beginning figures. As of today, the 17th of April 2020, before noon, we had 442 people in 20 states who were confirmed with COVID-19 in Nigeria. 35 new confirmations are distributed as follows: 19 in Lagos, 9 in the Federal Capital Territory, 5 in Kano, 2 in Oyo, and then the others are known. There are 13 deaths in all, and that's what has been recorded so far, with 152 people who have recovered from the disease and have been discharged home. This means that there are 277 persons who have COVID-19 and who are being cared for in our isolation and treatment centers in Nigeria. This recent marked increase in the numbers of new COVID-19 cases is traceable to scaled-up implementation of our new case-finding strategy, as well as the result of rising community transmission. It means, of course, that the lockdown is yielding some of the results. With house-to-house and cluster testing and using the revised criteria for sample collection, the yield has increased. More people with COVID-19 are being detected and transferred to treatment centers. There will still be more social mobilization for community testing at grassroots level and isolation of the positive cases. We shall continue the right messaging and make sure it is disseminated to control ongoing transmission. In this regard, I must again emphasize that all citizens are obliged to disclose complete and accurate information about themselves to the health workers they meet, especially about their travel history or contact with persons who have had or have COVID-19. This is important for two reasons. First is as a full disclosure allows health workers to promptly investigate and diagnose and treat correctly to improve chances of patient survival and recovery. The second is that the right information keeps the health worker safe, and withholding the truth puts both the user and the caregiver at risk, but also other patients who may be on site. Several health workers who must then self-isolate as a result of exposure to a positive patient will have to be out of circulation. This is not what we can afford with the limited number of health workers we have in our country. Infected persons need not hide themselves at home until their condition deteriorates, that they have to be rushed to the hospital in critical state. Some among the fatalities we have had may have been saved if they presented earlier rather than at the last minute. It bears restating that persons who have fever of unclear origin or cough should first put on a mask or a face covering of any type, isolate themselves from their friends and family, and call the national emergency number of 112, or also the NCDC toll number 0800 97000010, or they can report themselves to the nearest health facility for referral. Several persons who had COVID-19 have been successfully treated and discharged as proof that most people do survive the disease. I again request those who test positive to cooperate with health officers and to accept the designated isolation and treatment center, even if you feel very well. In the interest of the general public, the Ministry of Health, through the Nigerian Center for Disease Control, reserves the right to investigate suspected cases of COVID-19 who are not complying with advisory. And in addition, I also urge citizens not to pay attention to rumors and sensationalism, just as I advise purveyors of disinformation to desist from spreading fake news. As always, I want to commend our health workers, particularly the frontline health workers who have been managing our patients, and I urge all citizens to remember the public health advisories and the social measures and regulations around the lockdown. Please stay home if you do not have anywhere special to go. Observe all your hygiene rules and take all precautions. I shall now call on the Director General of NCDC.